Started. So good evening, everyone. My name is Jackson, and I'm the optometrist here at Eye Care Plus Mermaid Beach. So tonight we're talking about a new treatment we've brought in called the Inmode Envision. So this is the newest treatment in dry eye, and it's the latest available in Australia. And going to talk about a few things. So we're actually going to start simply by talking about what is dry eye, the symptoms of dry eye, what causes it, what we do to treat it, and then talk about more about this treatment and how it works and how it treats dry eyes. And then we'll have a section at the end where I'll be open to answer any of your questions. So just feel free to use the Q&A section, little chat box, type any questions you like, and I'll answer them as best as I can. So yeah, we'll get started. So dry eyes. So it's a big problem in Australia. Like people in Australia are becoming older and older, aging population. So naturally, as we age, people do report more ailments in general, but dry eye being one of them. So Optometry Australia reported 77% of Australians have suffered with dry eye, yet only 26% have seen an optometrist about it. So obviously, a lot of these symptoms of dry eye don't necessarily make people feel as though they've got an issue, and they mostly put up with it, but also a lot of the general public don't really realize that something can be done. So this is where we can make a difference to people's lives because as much as some of the symptoms can seem quite mild and harmless, the later severe end stage of dry eye can be quite severe. Can affect someone's life quite severely. Now, here's the symptoms. So these are not all the symptoms, but these are a range of common symptoms that people would experience. Dry, gritty, or irritated eyes. I mean, a lot of people logically can kind of put that together and it feels that they've got dry eyes. Red and sore eyes, burning and stinging eyes. Now, watery eyes is a big one. Actually, not many people would associate a runny eye as being dry. It sounds very strange. But quite often, watering is actually a reflex from the eyes being too dry. So, and for me, when I hear of someone coming with watery eyes, I mean, that's the first thing I think about. Dry eye, probably oil deficient dry eye. So that's, again, another symptom. Itchy eyes, crusty or gunky eyelids, blurred vision that comes and goes. So that's to do with the sight now. So again, not many people realize that our vision, not only is it made up of our eyes, our focusing, our lens, our retina, but our tear film also plays a role in how well we see. And if our tear film is unstable, the vision will fluctuate. Discomfort at the end of the day, and then eyes that are sensitive to light, glare, wind, air conditioning. So the point of the tear film is it's helping to help lubricate the surface of the eye, particularly the cornea. So cornea is that round, clear surface on the front of the eye, and it's one of the most sensitive parts of the body. So if you've ever had a scratch in the cornea, or if you've had an eyelash caught underneath your eyelid and it's scraping on the cornea, it's extremely uncomfortable. So when the cornea is not in a good state, it's extremely sensitive, and for patients who often have watery eyes, often find their eyes tend to run when they're exposed to air or exposed to light. So those are a few of your kind of symptoms. So if you experience symptoms like these, more likely than not, you've got dry eyes. So what actually is dry? So this is the definition, a chronic condition. So it's something that is ongoing, that occurs when your tears are not able to provide adequate lubrication for your eyes. So reduced lubrication damages the surface of the eye, which can lead to ocular surface inflammation and corneal disease. So yeah, so again, it's used to lubricate the eyes. The cornea is also involved in a lot of processes. It also, again, allows us to see. So at the end stage of corneal damage, the corneas can become hazy and actually can permanently cause blindness. That is the end stage of dry eye. But quite often people don't get to that point, that they usually would have sought help by that point. But it is broken down into two main types of dry eyes that we often see. So evaporative dry eye and aqueous deficient dry eye. So evaporative meaning the oil deficient dry eye, and the aqueous meaning the water deficient. So to break it down simply, our tear film has two main components, the oil and it's the water. And I'll explain what they do a bit later. So how do we diagnose dry eye? Well, it's to book in with an optometrist like myself, and I'll do an assessment. So the assessment with dry eyes quite often it's a little bit more involved compared to your regular routine eye check. There's a lot of different tests that we do, and a lot of different things we actually look for when we go and diagnose dry eye. So when someone comes into myself and they have all these symptoms that sound like dry eye. We usually do what we call a dry eye assessment. So I'm looking for all the reasons as to why their eyes are irritated. It could be dry eyes, it could be not dry eyes. It could be some people have allergies, some people have eyelids that don't completely close when they sleep. Some people have certain calcium deposits underneath the lids that when they blink, it scratches their eyes. A lot of reasons why they can become irritated. The biggest cause definitely is dry eye, but we always have to look for other little causes as well. And that really helps us kind of, again, tailor the treatment to the patient because not everyone's dry eyes or irritated eyes are the same. And we also use this also to determine the severity. So a lot of the tests we do have quantitative measurements, and we can use that to compare with, especially if we're looking at treating it, we can actually see clinical change. So this is how we test for it, but also how we kind of treat it. So it's not always about simply just coming in with these symptoms and we go right into treatment. We always assess first, especially if someone's been seen elsewhere before and been told they have dry eye. They may have been going down the wrong path. They may have been fine otherwise. But the causes. So the most common cause of dry eye is meibomian gland dysfunction. Number one cause. I would say it makes up around 80% of most dry eye patients. So the meibomian glands, what are they? They're essentially the oil glands on our eyelids. So you'll see a picture on the right-hand side here, where it's a close-up of the eyelid, where there's these white, thick pustules that are kind of sticking out. That's not a healthy-looking eyelid. So essentially, the role of the oil for our tear film is it acts as a protective layer over the tear film, and it helps to prevent evaporation. So a good example I like to give patients is imagine you've got a little plate of water and you let it sit in a room and you just let it sit and sit and sit. Over time, it evaporates. Now, if you do the same thing and get that plate of water, but you put a generous layer of oil over the top, it actually takes a lot longer to evaporate. So that's essentially what that oil does for our tear film. It keeps the tears on the eye. So for some patients, especially if there are watery-eyed patients, they typically have oil deficient dry eye because their tear film, without that oil, it's evaporating extremely quickly. Some tear films I've seen evaporate within a single moment. The moment they open their eyes, the tears they're already gone. So that's a key reason why a lot of people have dry eye issues, the meibomian gland dysfunction. Now, the second main cause is certainly blepharitis. And as much as we say it's like a second cause, quite often patients who have meibomian gland dysfunction often have blepharitis as well. They often come hand in hand. So blepharitis is we would say that picture on the bottom right there with those crusty yellowy eyelids and eyelashes. So blepharitis is an overgrowth of bacteria that's on the lash line. Certainly attributing factors, working in dusty environments, just generalized bacteria in the air, pollens, all sorts of things, debris that just get picked up by the lash line. Because the lashes, their natural role is really to provide like a filter for our eyes. So anything that's in the external environment, it won't get in our eyes, and then lashes will catch it. But the problem is not many people are taught to clean their eyelids, and this tends to build up. And the trouble with blepharitis is quite often it's not simply just bacteria on the lash line. People actually develop these mites that live on the surface of the eyelid because the mites love to eat this bacteria and they live on the surface and they also attribute to how irritated and inflamed lids are. So we call these Demodex mites, and there's a picture on that gray picture there on the left side, a little Demodex mite on the lid margin. So blepharitis and meibomian gland dysfunction often come together, and a lot of our dry eye treatments are based on treating these two conditions. And quite often we can get a very good result at simply managing these two things. Now, what are the other causes of dry eyes? So lacrimal gland dysfunction. So the lacrimal gland is the gland that produces the aqueous or the water for our tear film. That gland often is dysfunctional due to various medical conditions. So often if someone has autoimmune diseases like Sjogren's syndrome, rheumatoid arthritis, what's autoimmune, Hashimoto's. So there's all sorts of conditions that can cause these lacrimal glands to become dysfunctional. Contact lens wear. So quite often contact lens wearers complain of dry eyes. It's soft contact lenses particularly, they have a high water content, so which make them very comfortable initially, but as they dry out, they do take the moisture from the eye to retain its softness. Certain medical conditions can cause dry eye. We talked about this, autoimmunity. Medications, so specific medications that can really cause dryness is, I would say, Roaccutane, which is a acne medication. But certainly there's a whole array of medications out there that have a side effect of to cause dry eye. Age is certainly a factor, just generally speaking. Hormones, pregnancy and menopause, and lifestyle environmental factors. So I've touched on working in very dusty environments can certainly attribute to blepharitis, can lead on to dry eyes, but also lifestyle factors like using a computer for hours on end, that certainly can affect that as well. So here we go. So this is our introducing our new treatment. We're the first optometrist in Australia to offer the Inmode Envision. So extremely exciting. So we've had this treatment for about 3 months now. We started running these treatments in November 2023. And we've been getting some very good results. So that's the machine on the right-hand side. That's myself in China there. And that's that device there. And this treatment comes with 2 attachments. So on the left side, that's called the former eye, and that's using radio frequency technology. And that attachment on the right-hand side here with the lady with the patient with the eye shields is the Lumecca eye, which is the IPL. So what is the Inmode Envision? So, well, it's the newest treatment in dry eye, and it's using the latest technology. So what's very important to say, it is non-invasive. As much as this treatment, it has several parts to it, each part is certainly not invasive in a way that there's nothing surgical, there's nothing sharp being used, and ultimately very, very tolerable for all patients. So the first part of the treatment is called bipolar radio frequency technology. So what is this? So in terms of radio frequency, it's actually quite a new area, and it's been used in areas of skin aesthetics or beauty. And what it does is it helps to stimulate the dermis, which is a deeper layer of the skin, and it helps to stimulate collagen production. So in that way, it actually helps to smooth out fine lines and wrinkles, which is great. But how it really helps us here with dry eye is it helps to actually stimulate the meibomian glands, which are right at that dermis level. So not only does it stimulate the glands, so it gets them functioning better, it actually provides deep heating of the glands. And the heat is super important for our glands because ultimately it helps to break down all the blockages or the clogged oil glands there, and in kind of prepping it for expression, which is where we squeeze the eyelid, which I'll talk more about in a moment. So that's the radio frequency side of things. Now, how does radio frequency feel? How is it done? Well, pretty much it's that attachment on the left-hand side there. It's a little tool that we run over the lid, and the upper lid and the lower lid. And we put a bit of cooling gel over the top of the lids, but ultimately it just feels like a hot stone massage. And again, nothing too invasive and uncomfortable, just a hot massage over the lids is how it feels. Now, the second attachment of this treatment is the IPL. So IPL stands for intense pulsed light. And IPL has been around for a long time. So this is the newest technology in IPL. So in terms of the actual energy this machine produces can be turned up a lot higher compared to previous machines, which elicits a better result. So initially, IPL was used very early on as a treatment for the skin. So to treat rosacea, which is the redness on people's face, whether that be on their cheeks, on their nose, on their chin, on the forehead, all over the face. So what they found is, as dermatologists were treating patients with rosacea with the IPL, a lot of them noticed that their dry eyes seemed to improve as well. So then a lot of studies came after that to try to link that together, and it is now proven that IPL certainly is effective at stimulating meibomian glands. So that's how this treatment helps. Is it's a laser ultimately, and it's used to excite the oil glands, get them functioning, and similar to the radio frequency, really get them working so that the glands can produce the oil naturally. The great thing about IPL, it has a few other benefits aside from just pure stimulation. Because it is a high-powered laser, the energy is actually absorbed through the blood vessels and the nerves. And the higher the energy that's used, it actually is converted into heat. And therefore, as we talked about previously with the deep heat that the radio frequency provides, intense pulse light or IPL also provides a different level of deep heating through the absorbed energy from the IPL. So that again helps to break down those blocked oils, and which helps our expression. Now, another benefit of IPL is the effects it helps to treat rosacea. So again, rosacea being that redness on the skin. So there's a lot of studies to show that reducing rosacea, generally speaking, reduces the overall inflammation around the eyes and actually overall improves dry eye symptoms. So for this machine, particularly the Inmode Envision, we are actually indicated to treat the surrounding area. So that's your cheeks, your nose, your chin, your forehead, if there is underlying meibomian gland dysfunction and dry eyes. So that's a bonus where we can actually improve the patient's appearance and improve their redness. And the final benefit of IPL is actually it helps with blepharitis, particularly with this machine. So with the Inmode Envision, it's how it differs from previous IPLs. It has a new attachment that can be used to target the eyelids much closer than ever before. So the fact that we can run the IPL very close to the lid margin, it's actually able to destroy the Demodex mites that live on the lash line. And again, to improve blepharitis is in part able to help the meibomian gland dysfunction and reduce the symptoms in that way as well. So ultimately, the three main things: it stimulates the oil glands, produces a lot of heat, it reduces the redness, and it destroys Demodex. So a lot of benefits with the IPL, but with the newest attachments and the energy output. So all this obviously is treating the evaporative dry eye, the oil deficiency. So if it's able to treat that well, we're going to get more oil in the tear film. Tear film will be more stable, then our dry eye symptoms should be improved. So we talked about this just a moment ago. What does the treatment involve? Well, the radio frequency, again, feels like a hot stone massage. Very, very comfortable. I've had it done myself. It's it's definitely not an uncomfortable experience whatsoever. Now, the IPL side of things. Now, it can feel like a little flick of a rubber band with some heat attached to it, as well as a lot of bright light. This can be a bit uncomfortable, but certainly have a lot of patients go through it. And it's not something that is too extreme that patients are not able to tolerate it. So quite tolerable, but can be a little bit uncomfortable. Now, after we do these treatments, we typically perform a meibomian gland expression, which again is essentially squeezing the eyelid. Now, this is certainly, again, uncomfortable, but definitely tolerable. When it comes to meibomian gland expression, we are essentially mechanically unclogging these oil glands. You'll see this picture on the right-hand side here. They've had their meibomian glands expressed, and all that gunk has been left on the lid there. Normally, we wipe it off straight away, but that just gives you an idea of how much pasty blockages that can accrue in those oil glands. Typically, a healthy oil gland, when we express them, clear, watery or runny oil should be coming out of it. And you'll see here, this looks like a thick yellow paste. So this is certainly very, very unhealthy. So the point of unblocking it is obviously to unclog it. So once we've stimulated these glands with our treatment, the new oils will come through, and hopefully that will continue cycling through, and these won't block up as easily in the future. So whenever we do an expression of the meibomian gland, anesthetic eye drops are always used, and that really makes it much more tolerable. Even with anesthetic, it certainly is uncomfortable, but again, it's not something that people are not able to get through. We do this on many, many patients. So how many treatments do you need? So with any treatment, it depends on the severity of the patient, but our initial protocol is 4 treatments, and they're done a week apart. So we run the course of treatment, and that is really how we get things rolling. So for a lot of patients out there, especially the older patients, and also especially the older ones who have never had any treatments for their dry eyes whatsoever, there's sometimes a thought that a lot of times I'm thinking they probably need more than 4. That's a high probability of that. Because their glands have been inactive, have been dysfunctional for years and years and years, and it really takes a lot to get things going. But initially we always start with 4 and do a review in a month's time to see how things are going. And the next slide is talking about the expectations on when to expect a change. But for older patients and severe cases, yeah, usually we may need to do more than 4, but 4 is always the starting point to really get things going. Top-up treatments, what is required to maintain the results of the treatment. As much as these treatments are excellent and they do improve dry eyes, it is not a cure, and we're not expecting to do a single course of treatment and patients are cured for life. This is a chronic condition again, and we need to maintain with regular treatments and management. So when will I feel a difference after treatment? Well, with treatment, again, individual results will vary. And I certainly have had patients, especially even after one treatment, she called me up the day after and said she's been mind blown and she's had this huge improvement overnight. And we get those. But that's not what we're expecting for everyone, unfortunately. And typically, if I was to tell a patient and when to expect it, we usually say we go through the whole course of treatment, which is the 4 treatments, and then give it about 4 to 6 weeks. And we usually review at that point to see where things are. Again, back to the patients who typically have not had any dry eye treatments before, it does take time for these glands to reactivate, to start going, especially when they've been inactive for a while. So it does take time. But so I certainly have noticed generally a lot of patients after the 3rd or 4th treatment start to really notice some improvement there, which is great. And the effectiveness or how much improvements they get, again, depends on the patient to begin with, whether how severe their condition is, whether there are coexisting factors, whether they have maybe some underlying allergy also, or whether there is incomplete closure of the blinking, and a lot of things vary. But ultimately, what we do here is we don't just do treatments and send people away. I do review patients quite regularly, and we try to manage the other aspects of it if they have coexisting issues, and that's how we can get the best results. Now, contraindications, so that means who is not suitable for this treatment. So pregnancy. So it's not shown to be damaging to fetuses specifically, but with all pregnancy, we always take precaution. Implanted medical devices, so this is talking about pacemakers, implanted hearing aids. Those are the main devices, but some people have other devices implanted, so we typically don't want to be doing it for those patients. Patients undergoing skin cancer treatment on the treated area, so we're talking about obviously around the eyelids or around the skin region. And then patients who have recently had eye surgery. So if someone's had recent eye surgery, usually we allow them to have the eyes settled before we do any of these treatments. So typically around a month after eye surgery is usually pretty reasonable. Now, how much does the Inmode Envision cost? So the thing with these dry eye treatments, unfortunately, they are not covered by Medicare or private health insurance. And the treatment costs for the Inmode Envision, we are charging $500 per session. So if we're talking about the initial treatment protocol, that's $2,000 upfront. So I'm not upfront, but $2,000 in total. So in terms of the costing, obviously this is knowing that there may be additional treatments in the future as top-ups to maintain. And then what do I need to do at home? Well, as much as these treatments are excellent, there's also things you can do at home. And quite often when patients come in to see me about their dry eyes, It's not come in and then we do a treatment. I mean, there's a lot of things we can talk about, especially in terms of daily routines, and all these little things can add up sometimes. So, and also get a lot of patients who come in to see us and they've already been doing all these things and haven't been getting much result. And for those cases, sometimes I find that after we do a treatment like the Inmode Envision, these little things on a daily basis go a lot further. So we'd never kind of underestimate the value of the daily routine. So to talk about a few little of these things, these are all available at our practice, or you can buy them on our online shop. But the first things are called OcuSoft eyelid and eyelash cleanser. So it's a foam cleanser that helps to remove the debris from our lashes. So this is obviously very helpful to remove all that crust or the debris. Helps with a bit with the Demodex mites as well. So very, very good cleanser, very gentle. So a lot of people tolerate this very well because the thing with blepharitis is something that needs to be done daily. It's not like we clean the lids, for a week and then we just ignore them for the rest of the time. So it's an ongoing maintenance. The next product is Avenova, so eyelid and eyelash spray. So Avenova is a product that uses a solution called hypochlorous acid. So it's a solution that's derived from natural white blood cells, which is antibacterial in nature. So it's sprayed on the lids and eyelashes and wiped off, and it helps to fend off the bacteria that accumulates in blepharitis. Now, the third thing here is the electronic eye warmer. And as well as our derm eye mask. So these are warmers to help us perform our hot compresses. Now, hot compresses essentially help to soften the oils so the oils can come out a bit better. And the fourth thing on there is our dry eye fort supplements. So these are supplements that can be taken orally, and a big component of it is omega-3, which is fish oils. But there are also other components to this, and it all is to essentially help support a healthy tear film. So a lot of actual studies behind dry eye fort and how it can improve dry eye symptoms simply by taking a tablet or a capsule. So yeah, these are things that can be done. And a lot of times when we do dry treatments, it's not about choosing whether you do a dry eye treatment or you do your homework at home. It's a matter of for best practice or best results. Usually, doing everything is the best way. So obviously we do have other treatments as well. So it's not as much as Inmode Envision is the newest treatment we have available. It is not something that's replaced everything. It is in addition to what we have. So again, the exciting thing about Inmode Envision I think it is the first ever combination treatment. It's come out having two attachments to it, and I don't think that's ever been done before. And I think that opens up a lot of thinking in a way that a lot of treatments can be combined to elicit a greater effect. So the Inmode Envision utilizing that radio frequency as well as the IPL. But other treatments we have here is we've got Rexon Eye, we have our EI IPL, BlephX is a specific treatment for blepharitis and blephasteam. So in a way, even the thought process is even Inmode Envision can be even further combined with any of these treatments here as well to, again, get better results. So there's a lot of information on our website about these other treatments as well, cost as well, it's all on there. And so if you want to read up any more, feel free to visit that. Our website is www.icareplusmermaidbeach.com.au, and everything is pretty much there for you to read. So yeah, that comes to the end of the webinar. So here's a question time. So if anybody would like to ask any questions, feel free to type it on the Q&A chat box, and I'll try to answer them as good as I can. I'll give you guys a few moments to type some if you like. All right, so we have a question here straight away. It says, can you drive after a treatment? Well, certainly yes, but what we do notice is some patients do notice a little bit of blurred vision after the treatment. The blurred vision can last a good up to 15 minutes or so, but after that, pretty much right to drive. A lot of patients do precautionarily kind of come in with a family member to drive them just in case. So there is some blurred vision to be expected. So that's... Any other questions? I think no more questions. Cool. Well, thanks everyone for joining in tonight. So hopefully everything I've said today was enlightening, and hopefully I've explained everything okay. You know, some people find it very interesting when they hear that there's mites on their eyelids and everything like that. But ultimately, that yeah, I hope yeah I've been able to explain what this new treatment's about, and yeah, we're always at the forefront of dry eyes, and we're always embracing new technology. So in the future, no doubts there will be another time when we'll be possibly introducing a new machine or a new treatment. So it's always exciting in this area. So it's very, very new, and you know, not many people are treating dry eyes. So it's important to be you know, keeping on top of the newest technology. But otherwise, I shall close that now, and hopefully everyone has a good night, and hopefully I'll see people around. Thank you. Good night.